Now recording. All right. So, welcome and thank you for joining us on this Monday to the Be Your Own Best Advocate Navigating Kidney Disease with Confidence presentation that we have. Today, I'd like to welcome Pauline Camirand. She's a clinical educator for the Kidney Health Manitoba program at Seven Oaks General Hospital in Winnipeg. Pauline has been a nurse for the past 15 years, with 13 of those years in kidney health. Her true passion for renal care stems from seeing her own grandfather, who spoke no English, but he had to navigate through kidney failure, go from peritoneal dialysis to hospital admission to hemodialysis treatments that were done in the hospital. It must have been so scary for him to be going through all of that without really knowing what was happening because he didn't speak the same language as his care providers, and he also didn't have the resources available at his own disposal to gain understanding of what it was that he was going through. So it's through seeing her grandfather's struggles that Pauline wanted to be involved with kidney care so that she can play a small part in bridging the gap in patient understanding of what is happening to them and also what options are available. So I will pass it over to Pauline and we will get this presentation started.
Hi, everybody. Thank you for having me here. It's a real honor. I've never done this before, but thank you again. Um, I just want to let you know that if you have any questions, can you save it to the end? But if you have like a comment or something you want to make, you could definitely type it in the message. I can't see it, but Heather is kind enough to help us read it out and facilitate that part. I'm just going to flip my screen over to share so I could show you my presentation. Can everybody see my slide there? I'm going to take that as a yes.
Yes, it's good to go.
Okay,
Thanks for
thank you,
checking.
Heather. So thanks for having me again. My name is Pauline, and like Heather said, I'm a clinical educator for the Seven Oaks Hospital for the renal program. I think it's very important that patients understand, regardless of which part of the disease trajectory you're at, meaning if you're going to renal health clinic before starting treatment or even starting treatment, that you need to understand that every patient has their own voice, and they need to utilize that voice to achieve the best care that they can. And the only way that you can do that is to voice your concerns and to develop a collaborative approach with your care team. So that's your doctors, your social workers, your pharmacists, and of course your nurses. Because if you don't participate, it's hard for us as care providers to help find out what is the best care for you, because we only know textbook, right? But not everybody is a textbook. So that's why we need patients to voice their concerns and to help us look for the best care that we can for them, because everybody's different and their disease trajectory is different, kidney function is different, life situations are different. So that's why it's super important that patients join in that care perspective and develop a trusting relationship with your care team. This is especially important because if you're going into a new clinic, you're being told by your um, doctor, your family doctor, that, oh, your kidney function is not the greatest. It's at a certain percentage. We need to refer you to a specialist. And that's all you get told. Well, it's pretty scary. You've gone through life, living the way you do, and all of a sudden somebody's telling you something is wrong and you get nothing else. That's pretty scary. You don't know what the future holds. And it's especially scary if one day you go into the clinic and they're like, oh, you need to start dialysis right away. We really hope that that's not the case. We like to prepare patients for treatment when it happens, but some people do go through the kidney disease trajectory without any warning. You get referred to the clinic, and the next thing you know, you're on dialysis, which isn't fair to you because it's scary. You're being put in a situation where you really don't know what's happening. And that's why, as educators, it's really important for us to increase your knowledge so you know what's going to happen in your life, right? And we also have to understand what's important to you and kind of tailor treatment plans around your needs, because at the center of it all, the patient, the person, is our most important factor. We change our care in terms of how it meets their need. So how can patients open up their voices to gain better care? Well, the first thing is you got to be present during your clinic visits. You got to be engaged, ask questions. If you don't know what they're talking about, ask for clarification. Another really big thing that patients should really consider is participating in research projects. Research projects are always looking for patient partners so they can actually get an outcome of that project that's tailored towards achieving what patients need and not what looks good on paper. Do you understand what I'm kind of saying? There's no point of us creating anything when patients themselves have never looked at it. So in Winnipeg, we have a really good program. It's called the Chronic Disease Innovation Center, located within Seven Oaks. And it's a group of doctors, nephrologists, and family practitioners who come together to determine if there is a certain disease they want to focus on, a chronic disease. And they look for different things, different research projects that can add to the care to achieve better outcome for patients. So, for example, one of the research projects that came out of the Chronic Disease Innovation Center here is exercise while you're on treatment. The idea is that when people are actively moving while they're sitting in the chair during dialysis, by that I mean when there's a stationary bike attached to their chair and they're biking, it actually improved dialysis outcomes in terms of decreasing cramps and low blood pressure and increased heart health and lung health. So that's a really good project that came out of there. Another one is one of our doctor invented a calculator that determines what are your risk factors in starting dialysis in the next 2 years and 5 years. So that wouldn't have been possible if we hadn't had any patient partners. So for people who are interested, and there's research facilities out in your area, it's a really good thing to be a part of. Like I said before, being present in your own care is super important if you're trying to achieve the best outcome for yourself. So I would encourage you to not be afraid and just to ask all the questions you need to ask if you don't understand something, because we don't know that you don't understand if you don't let us know, right? So be very vocal in your concerns. It's also very important for patients to be open and honest. If we are asking you, hey, do you take recreational drugs? Don't think that your answer is going to make us look at you in a certain way, because it really doesn't. We just need that information so we can tailor our care to what you need. So don't ever take the questions that we ask as a factor of judgment, because it really isn't. We ask the same questions to everybody else, and just tell us the truth. If you're taking recreational drugs, it's okay. You just let us know, and always ask for clarification, like I said, so that you could develop a trusting relationship between all your care provider and you. And I think it's super important that patients understand that we want you to trust us, but in order for us to give you that trust, we have to earn it, right? So you have to participate in this care team for you to gain, for you to develop trust for us, because it's just not given, it's given over time, right? So in terms of, well, what kind of questions or what can I do to be more involved? If you're coming from a perspective of you're not on dialysis yet, but you're seeing a nephrologist because your kidney function has declined, so, how you can be more involved in your care is to attend education classes that your facility might be putting on. I'm not sure what other provinces do, but here in Winnipeg, we do offer all patients with who are referred to a nephrologist when their kidney functions below 30% to attend information class, and that's with me. And we kind of talk about what to expect when your kidney stops functioning. What does life look like? What kind of treatment options are out there? And how do you navigate those treatment options? So if your region offers those kind of classes, I would highly suggest you go to them just so that you get more information regarding your health status. So when things come up, you're not met with fear. Fear is never good. It's always better to empower yourself with knowledge so you understand what's happening, so you're not scared when it actually happens. And of course, you should always take your medication as directed. And if your doctor is giving you a medication that you're not sure what it's for, just ask them. And if you feel symptoms after starting your medication, don't write it off as, oh, this is normal. The doctors know what they're doing. This is part of the game. Don't ever feel that way because maybe it isn't normal. Nobody knows really, right? Until you vocalize it. So make sure if you are on new medication or you're currently taking medication and you all of a sudden don't feel right or you feel funny after you start the meds, make sure you talk to your care team and get that figured out. And of course, the biggest thing is make sure you attend all of your clinic visits. And it's really important that you do blood work before you attend those visits. It might be really annoying that we're calling you all the time and saying, hey, so and so, did you do your blood work yet? Because your appointment's coming up next week. The only way the nurses and the doctors know how well you're doing is by asking you of how you feel, of course. But the biggest way that we know is by looking at your blood work. Without that blood work at those clinic visits, we have nothing to refer to in terms of what your body is actually doing. So make sure you do your blood work. That's super important. So, other questions that you should ask when you're in renal clinic is, what does my blood work look like, and what do they mean? Um, it's kind of uneasy, even if it's for me, to have blood work done and not know the results. Well, if they tell you the results, they could tell you, yeah, your hemoglobin is this, but what does that actually mean? In terms of symptom control, if you have certain symptoms, maybe ask the doctors and nurses, these are the symptoms I feel. What do you think it's related to? And what can I do to fix them in terms of exercise and diet and just lifestyle, right? So make sure you ask those questions. It's especially important for patients in renal health clinic to ask about, well, what's my hemoglobin look like? Because hemoglobin is related to oxygen carrying capacity for your body, and is directly reflective of, when you feel cold all the time, even though it's like warm in the room, and you feel cold or you feel more tired than usual. Well, it could be because your hemoglobin's a little on the low side. Well, how do I fix that? You can fix it by looking at your iron stores because we need iron to make hemoglobin. Well, if your iron stores from your blood work is low, maybe you need iron supplement, right? You're also going to look at things like calcium and phosphate because it's related to your bone health. And it's important to ensure that your calcium phosphate level is within baseline, just so it doesn't interfere with how well your bones are built, right? Another thing is your hemoglobin A1C, especially if you're diabetic. We know that diabetes play a large role in exacerbating health conditions. So make sure your sugars are in check, which is super important. And is there anything you can do to maintain your kidney function so you don't have to start dialysis? So, with the renal health clinic, before you start going to treatment, our biggest concern is how do we prolong your kidney functioning at what it is now for as long as we can? So we call that residual kidney function or kidney function in general. We want to preserve that kidney function to stave off dialysis. So we need the help of you, of course, the nephrologist, nurses, and dietitian to maintain your kidney function as it is right now. And one of the ways that we do it is maintaining a healthy lifestyle and make sure you're taking the medications like you should. So participation from patient is vital in that aspect of kidney care, right? And another good thing to start asking your care provider is, what is my probability of transplant? So transplant is not a cure. excuse me, for dialysis or for people on um, kidney with kidney disease, but it is a treatment option. And it's important that you understand what are your probability or what are your chances of getting a transplant and what does that transplant roadmap looks like, because transplant is the ultimate goal for everybody. You get a transplant, you get a working kidney into your body, so then you don't have to be on dialysis. But that comes with its own set of responsibilities as well. But it's important to see what are your options regarding transplant and maybe look into it because it is a really great treatment option. So let's shift our focus to people who are actually in treatment. So, treatment meaning hemodialysis or peritoneal dialysis. Well, how do you gain a voice when you're on treatment? It's important to know that as patients, as nurses, we do whatever we were taught to do according to a textbook, according to user manual of those machines. But we actually don't know how it affects you if you don't tell us. So, you know how when you come into treatment every time and we're asking you the same 12 questions that we ask you every single treatment, and it gets pretty annoying, right? Because you're seeing us every other day. Well, those questions will help us determine how should I care for this person today? You are you are more than just a number. You are more than just a person in a spot for treatment. To me and to a lot of nurses I work with, every patient is an individual. There's somebody's mom, somebody's dad, somebody's brother, sister. They're still a person, and that's what we focus our care on is the person themselves and not the disease in themselves. So when we ask you those questions, we tailor our care to your answers to the questions. So that's why it's really important that you come to every treatment and you answer our questions very honestly because it can change the way that we provide care. And it's also very important for patients to let us know if something isn't working. So, for example, if I take you down to a new dry weight and all of a sudden your blood pressure drops at home and you feel dizzy, well, you need to let us know because that to us means that we've taken you too low and we've dehydrated you. And that's not great. So, it's not unusual for patients to feel tired after treatment. When they get home, they might need a nap. So that's not unusual, but it is unusual for you to feel worse leaving dialysis than when you came in. You shouldn't feel so sick that it makes you scared to come back to dialysis. That is not the point of dialysis. But like I said, if you don't tell us how you felt at home, we can't alter our treatment plan if we don't know that there's an issue. So it's really important as well for patients to understand when you're coming into dialysis, it's not really about the amount of fluid that we're trying to take out. It's really about how much fluid do I need to take off to make you meet your dry weight. And we're going to talk about that later on. But dialysis is always two-part. It's always fluid removal, so removing the excess fluid that you have on board, as well as removing the toxins or waste product that's sitting in your bodies because your kidneys can't do it for you. So, as patients, your responsibility is always to come to treatment and always be honest with us and ask us questions. Another thing is please keep healthcare providers accountable. So, what I mean by that is always make sure your nurses, your doctors, your social worker, whoever it is that comes to your bedside, they're washing their hands before they come into your bed space because we're trying to prevent germs from being around your area so then you don't catch it and become sick because a lot of you are immunocompromised. So we're trying to protect you. And part of that protection is proper hand hygiene and washing your hands and making sure if we're accessing your central line that we have a mask on. Another thing is making sure that our fluid calculation is correct in terms of what are we trying to remove today to bring you down to your ideal post-treatment weight. So, like I said before, when you come into dialysis, some patients are hyper focused on thinking about, oh, I want to take off this much, like, say, for example, 1.5 liters, because every treatment I take off 1.5. That's not how we should look at it. How we should look at it is, what is my dry weight? Your dry weight meaning, because your kidneys don't work, you naturally will retain all the fluid that you take into your body from drinking soup, water, coffee, whatever it is. So from that, what is my ideal weight when I have no excess fluid on board, when I feel my best, and when my blood pressure is within range? That is what you should focus on, your dry weight. That's the weight I want to be. But just like anybody else, your dry weight will go up and down depending on if you gain some weight, like solid, like mass, or if you're losing weight. So that dry weight will fluctuate with weight gain and weight loss. Another thing to look at is total. We're going to look at dry weight first, then we're going to look at the total amount of fluid you want to take off, because sometimes your body can only handle so much fluid being taken off over your treatment time of 3.5 to 4 hours. Anything more than that certain amount, you might not feel good, right? So talk to your nurses and develop a plan that way. Um, Another thing is, the more fluid you have to take off during dialysis, the more tired you're going to feel, because it takes a lot for your body to balance out the dirty blood and the clean blood and the extra fluid and the no fluid. It takes a lot of work for your body to fight and balance itself out, right? So, with that being said, adhere to your fluid restriction if you have one. Not everybody has one, because if your kidneys are still working a little bit and is still removing fluid, dialysis is more for removing the a little bit of extra plus cleaning your blood for sure. So, depending on your kidney function and how well it still works, you might have a fluid restriction, and it's important to adhere to that fluid restriction. But it's also not okay for you to not want to drink anything. Just because 60% of your body is made out of water, we need water for your cells to work properly. So you still have to drink, but sit within that allotment of how much you can drink, and the nurses and the doctor could tell you all about that. Okay. Um, so we talked about, well, why do I ask the same question to you all the time? It's because we tailor our care to the answers that you give us. Another thing that happens during treatment is your machine will be alarming all the time, right? Well, not all the time, sometimes. Well, it's important for you to understand what those alarm means and how do we fix it. Because those alarms are very loud, and it's kind of distressing sometimes if your machine consistently ring off. So it's okay for you to ask the nurses, why is it alarming? What can I do to help? So then the alarms will stop. Because there's actually things that patients can do too. One of them being, if you have a central line, we ask that you, if you're laying flat on your back or to the right and it rings off, maybe if you lay on your left with a pillow tucked behind your upper back, that will help the line function better, because the tip of that line is not touching the wall of your heart. So that's what we ask patients to do sometimes, body repositioning, sometimes clearing your throat. Sometimes patients would occlude that line because they're either talking or they're moving around too much, right? So then we just tell patients, oh, do you mind not moving around so much? Or let's get comfortable before I increase the speed of your blood going through the machines. So there's a lot of things that patients can do during treatment that would help the nurses provide better care. So we have to work as a team to get there. So, another important thing to ask is, what is my blood pressure range and what does it mean? Everybody seems to think that, oh, if my blood pressure is around the 90s, I'm okay to go. Like 90 systolically, that's actually not the case. We like everybody's blood pressure to be around the 110 mark. But if you generally have low blood pressures in the 90, maybe that's okay for you. But it's not okay for your blood pressure to be low and for you to feel dizzy when you get up and start walking, because that tells us you don't have enough blood in your veins to circulate around. So if you feel kind of lousy, but you want to get out of here really quick, I would suggest that you let the nurses stabilize your blood pressure before you leave, because you can faint, you could feel nauseous, you could start throwing up if your blood pressure is on the low side. So we just want to ensure that everybody's safe when they leave our care. And in terms of vascular access, so vascular access means um, how does the nurses take blood out of my body? So there's two types. So there's a fistula and central line. So to be an advocate for your own care, make sure that you keep the nurses honest when they're changing your dressing and when they're accessing your fistula. Look down at your fistula and make sure that when nurses are accessing or putting needles in your fistula, that they're rotating the sites and they're not going in the same spot over and over and over again. When we do that, we actually damage your fistula and we could cause issues. But if you rotate the sites going up and down your whole arm, we can actually prolong that fistula and promote it from growing bigger. Like promote it to get it to the point where your fistula is well developed for your whole arm, and we could use your whole arm for needle access. That is what we want. We don't want it so you start getting those bumps on your fistula arms or old puncture sites that are not going to heal because that leads to problem. So keep nurses accountable by making sure they wash their hands, they rotate your sites if you have a fistula, and they put on a mask and they scrub your central line really well before they access it. So to decrease the complications that can happen when things aren't done properly. And that concludes my presentation. So I
Okay,
will.
I'm back, and I just want to, first of all, thank you so much for your presentation. Your insights were both really empowering and also super practical, and I think others will think the same as well. I'm going to make sure that we are stopping our recording, and